I'm Laura Ellen Christian with AGE-u-cate Training Institute. I'm here with my colleague Julie Bogus with AGE-u-cate, and we are so excited to be joined by Shannon Effler and Dr. JoAnne Burke. So a little backstory, Julie and I attended the end of last year the Midwest Dementia Summit, which was the inaugural first summit that was hosted in the area. And we just had the best connection and collaboration with people there. And Shannon and Dr. Burke were two of those people that we had some really great connection and collaboration with. We were there offering our Dementia Live program and for people to go through the simulation. And both Shannon and Dr. Burke offered some really engaging sessions themselves that we were able to attend. So through all of that experience together, we had the great idea to come to you on a webinar early this year to continue some of the conversations that we had and include you in those conversations. So again, thank you for being here. So Shannon, do you want to start and just introduce yourself and whatever you'd like to share with folks?
Sure. Thank you so much for having me today, and welcome to everybody. So I am Shannon Effler. I am the Director of Geriatric Programs and the Associate Director of IMAGE, which stands for Innovating, Maximizing, and Advancing Geriatric Education at Indiana University. So I wear many different hats in this role, as I'm sure we all do in our respective positions. But one hat that I wear is I serve as Indiana's Dementia Strategic Plan Coordinator. So this means that I coordinate the operations and implementation of our state's Dementia Strategic Plan. Additionally, I'm a social worker and have served older adults and those towards the end of life in a variety of different ways throughout my career. So thank you.
Fantastic. And Dr. Burke, do you want to introduce yourself?
Hello, everyone. It is a true pleasure to be with you today. I guess I am supposed to be retired, but I don't like that term very well. I am right at the top of the baby boomers, and I just first of all want to say thank you to everyone who is here today and is working with those of us who saw 65 a time or two a little time ago, let's put it that way. I used to tell my traditional age college students at St. Mary's College, where I taught for many years social work and nursing and founded the gerontology program up there in Notre Dame. And I used to tell them, there are so many of us, you will always be employed if you're working in the field of aging. So we are here, I think. Even though we're in a time of a lot of challenge right now in the United States, we also have many opportunities. So I hope we can talk about all of that today.
Fantastic. Thank you, Dr. Burke. And while we are getting a few PowerPoint slides teed up, I am going to launch a poll so you can kind of share with us who you are a little bit. So this poll is going to ask which sector you represent. So I'm going to launch that poll. And we'll give just a few seconds here, about 30 seconds for everyone to make your selections. And then I'll share that. So it says, choose your sector that you represent. We've got Dementia Friendly Initiative. You might be with elder care services, maybe a university or community college, a hospital system, community-based organization, or faith community. So pick the best one that represents you, right? All right, it's still moving. We've got 75 of you who have made a selection. So go ahead, you've got about 5 seconds. As I do with my children, I'll count down 5, 4, 3, 2, 1. All right, we're gonna end the poll. That's usually when they're in trouble. You're not in trouble if you didn't answer, that's okay, but I will share the results here. Can everybody see those? All right. So it looks like we have a tie between Dementia Friendly Initiative and community-based organizations that you're here with, followed by elder care services, and then a handful from colleges, universities, and hospital systems. All right. So I am going to introduce our topic and then turn it over to Julie. We're going to focus on the road ahead, public policy and aging services, workforce innovation and sustainability. Julie.
All right, well, welcome. And again, Shannon and Dr. Burke, so glad to have you with us today. I so personally enjoyed the conversations that we had at the Midwest Dementia Summit last fall. And my passion for a very long time in this industry has been around workforce development and really asking the question, what do we need to do differently? We all are aware of the challenges that are facing us in this industry, the numbers of people that we have, as Dr. Burke mentioned, but more than that, it's the people that are prepared to step into this industry and work on behalf of older adults. And so I'm just glad to have both of you, and I'm going to kick off our conversation here with our first question to Miss Shannon. As you said, you fill a lot of important roles in Indiana, focused on advancing the aging services workforce. What are the most significant issues that you see facing your communities and the service providers? And Laura Ellen's going to put up a poll that's going to ask all of you, the attendees, the same question. What are the most significant issues facing you? So Shannon, while the poll is coming in, why don't we have you go ahead and start the conversation on that?
Okay, great. So thank you. And yes, it is a true honor of my career to be able to serve Indiana in this role as the Dementia Strategic Plan Coordinator. I also work on adult protective service work and a variety of other aging programs. So this is a big question, right? What are the most significant issues facing communities and service providers? So I don't think it's news to anyone on the call today that we are facing many, many, many significant issues, right? The work we all do is really challenging. So not only are we navigating the complex and dynamic needs of the people that we serve, but we're also navigating very complex and under-resourced health, care, and community-based systems. So we're layering complexity on top of complexity on top of complexity. And for us as individual contributors to this field, that can often result in burning out. So I want to draw your attention to the slide that has a photo in it. It's a wagon wheel, if you haven't noticed. You can actually purchase this very wagon wheel from Lowe's online if you are so inclined. But why did I put it on here? So one, it fits very well with the theme of today of the road ahead and moving down a road. But overall in my career, I think about the wagon wheel a lot. To me, it represents a center, and it has spokes coming out of the center, and those spokes are also connected by the outside ring. So I believe that what is in the center defines, contributes to the spokes, and the strength or lack thereof is represented by the outer ring. So think of this like a metaphor or a visual. So the center of this wagon wheel is our most significant issue that we face in our work. And I would say that the center, which is our most significant issue, is a lack of societal value for older adults, the process of aging, end of life, and for people of all abilities. So that we don't appropriately value this phase of life. And then the spokes represent all the challenges we encounter daily. So a lack of a workforce, high cost and poor quality of care, low public awareness of the needs, the challenges, the work we do, disparities, lack of access to the services folks most desire, like home and community-based services, a low incorporation of the people's voice in policy decision. The list could go on. And the outer ring currently has bumps and holes in it. So if you were to use this on your wagon, you're certainly in for a very bumpy ride. And many of us ride that bumpy journey every day, day in and day out. But bear with me, and I want to ask you to kind of flip it. So let's say we can move our society more and more to a place of honoring and valuing older adults, valuing the process of aging, end of life, and for people of all abilities. If that were the center of our wagon wheel, so kind of back to what Julie said, like, what can we do differently? Then the spokes would drastically improve. We'd have an ample workforce. We'd have affordable cost and high quality care. We have high public awareness of all the complex process and conditions of later life. We'd have equity. We'd have access to home and community-based services and a high incorporation of the people's voice in policy decisions. Our outer ring would be strong and smooth, and we know the direction we need to steer because we know that our society values the population that we serve. So we have an easy map to read, to navigate this wagon down the road. So the policy work I do, and I invite you, if you're not already engaging in it, is to focus on changing the center of that wagon wheel from our most significant issue to our greatest strength. And later on, I'm going to share some suggestions on how to engage and do this together. So thank you.
Wonderful. That's a terrific introduction, Shannon. And I think that you've laid a great groundwork for continuing conversation on this, beginning with changing the narrative about how we think about older people and the value that we assign to them in our society. So Dr. Burke, I'm going to turn to you now, because when I met you at the Dementia Summit, you had a really fascinating way of looking at this and talking about things that we need to do differently. And I think what you have to offer today highlights the fact that we can and should change the way that people think about care partnering and working in this industry. So, Dr. Burke, you speak about how local communities and service providers have opportunities to develop new approaches. And that's really what we're talking about here today, are new approaches, because I think we can all agree that what we've been doing is falling short. So how do we develop these new approaches and adapt to our population aging? And what are these new opportunities? And will you explain the scientific evidence behind moving in a new direction?
Thank you. Shannon, I really liked your wagon wheel, and I'm going to use that for my introductory remarks here a little bit. You know, most of our local communities were developed at a much earlier time when we didn't have this many people living this long. If we turn the clock back to 1800, our communities had no idea of what childhood really meant. We didn't have a conception of childhood then. We didn't have much in our communities that fit children. As soon as children were about 4 years of age, if they were in the working class, they got a bucket of water to carry. We really didn't have a concept of childhood. And I think what you were talking about, Shannon, was this whole concept of what it means in these later years now, because that's a rather recent change for us. And we don't change easily or quickly, usually, as human beings. So, you know, our communities develop schools and playgrounds and all kinds of activities and for children and accommodated young families. And we're still in a very early stage of development for accommodating our local communities to these later years. And actually, what that gives us is a lot of opportunities. And I think as service providers, we're kind of catching up too. Now, that may sound just absolutely ridiculous, but let's get into this just a little bit more. You know, sitting in a rocking chair and being lonely is not a desirable destination for our later years. We still lack meaningful social roles in our communities for older adults. So we have a lot of opportunities now to better utilize the social capital that the later years provides. Our older adults are not only burdens on society, although we get characterized that way sometimes. We're doing a lot. We're contributing a great deal to our local communities, and that's not always recognized real well. Even in the area of providing jobs in healthcare, we have a number of you working in healthcare, and without Medicare and Medicaid, you wouldn't be being paid. So we are really have really caused the entire healthcare system to have more workers in it. There's so much we need to do in our local communities. We have opportunities to build housing that better suits older adults. We have many older adults living in houses that are too large or two-story, or we have zoning ordinances that need to be changed because many of us will probably need to live with our children. Some of our children will spend more years in parent care than they will in child care. We just have a lot of opportunities to do many, many things. And I think that currently it seems to me that our public policies are actually devolving back to about 1800 when we didn't have federal and state programs for education and healthcare and long-term services and support. So that wagon wheel really spoke to me very deeply, Shannon. Um, I as a person who, well, I'm older now and I need some services and supports, but you know, thinking about working in this area, I don't know that I'm looking for a great deal to come from above, so to speak, in federal and state programs, although I think that these state dementia plans really begin to talk with how we get a workforce ready to go. But most of our work's going to have to be done at the local level in our organizations, in our healthcare systems, in our assisted living facilities, in our nursing homes, in home health care. We're going to have to get very innovative in what we're doing. So I think we have a lot of opportunities here, but boy, we have to think differently than we have in the past. And so a lot of this has to do with social connection. That's what Julie was bringing forth and talking about. And you know, uh, I got into learning about Stephen Porges's polyvagal theory in a really unusual place. I volunteer at a therapeutic writing center, and I was I wondered why equine assisted activities were being used in behavioral health with people that were in behavioral health programs, in some of the social skills training for children and adolescents. And so I just observed as I watched some of the classes and found out that horses are mirrors. They mirror what's going on inside of us, our inner states of being. And they use horses to help with social skills training because it helps people get more aware, more mindful of their inner states. And I thought about that. It's used with treating post-traumatic stress disorder and some other applications in behavioral health. And I started thinking about our relationship when we're between a caregiver and the care receiver. And I thought, well, I wonder, let me dig into this a little bit more. And does this begin to explain? We talk about empathic responses and so forth. We do a lot of training, but I didn't ever quite get the explanation for how this was so deeply involved in our autonomic nervous systems. Now, I saw my traditional age college students transmit anxiety to one another before they had exams. So I've seen anxiety get transmitted, but I didn't understand what we really do transmit what's going on inside with other people. So, this particular theory, I think, can be very helpful when we think about our work in caregiving. We This theory talks about how our sympathetic pathway and our parasympathetic pathway begin to get activated, and that's the inner state that I these horses seem to pick up on. That's what I was seeing, and I couldn't understand why it worked. Well, it is because they sense they're prey animals, and they have to be aware of what's going on around them. If they have uh, an animal attacking them, they leave. They're always on guard. Well, what I didn't understand was that human beings, we are always aware of what's going on around us too, but we're not conscious of it. But our autonomic nervous system responds to it. And we can either, if we feel relaxed, then it's the parasympathetic system that's involved in that, or our sympathetic system can get us into fight or flight. Let's go to the next slide, if you can. And this polyvagal chart, if you think about a day where you're caring for a number of people and older people in some care settings, if you're coming in and you're really down or depressed or agitated or whatever, it can make it more difficult in the day as you approach people, particularly people with dementia. I think, you know, if you come in and you're calm, it makes the interaction go so much better. Let's go down and look at the bottom of the chart where it's green and talks about social engagement. Polyvagal theory would say in the ventral vagal state, in the parasympathetic area of that system, when we're feeling safe and calm, we're mindful in the present. Look over at the right side and you can see that has our digestion's better, our resistance to infections are better, our circulation's better, our whole system's better and functions better. When we get into fight and flight in the middle, we have other problems. This is neuroception in action.
Oh, sorry.
Let's stay in the middle here. Okay. Oops, go back. Could you go back a slide, please? There we go. If we feel fear, if something's not right, we get into fight or flight and look over on the right side. We can see changes in blood pressure, heart rate. Our immune response even goes down. And if we get really, really, really overwhelmed, and this is where people who have post-traumatic stress often get into, we can get into the dorsal vagal state and just freeze. And you can see dissociation, you can see depression, numbness. And then you look over on the right side and you can see we're immobilized, endorphins kick in, we have decreases in heart rate, blood pressure. We just shut down. And all of this happens and it's below our consciousness. We just kick into these things. Unless, let's go to the next slide. So in polyvagal theory, this is called neuroception. We're responding to what's going on around us. And if we're emotionally and physically connected to others through trust, then we're in that relaxed state at the bottom of that chart, and all goes much better. And otherwise, we have these other states that we get into. You can go to the next slide, please. So,
Dr. Burke, I want to just jump in real quick and take everything that you've just taught us about how people are wired for connection, how our state of mind and preparation as a care partner can affect, just like you were saying with the students, how our state impacts our ability to be an effective care partner. Do you consider this fact to be an important training component for all aging services workers? And I'll ask you, do you believe that it's been a missing component? And if it's been missing, is this something that is an important part of preparing caregivers to do this important work with older adults, and particularly those that are living with dementia?
well, this theory began to explain things to me that at a scientific level, this is evidence-based theory. This has been studied extensively.
Mhm.
And all the years I taught in social work, we talked about warmth and empathy, and in nursing, we talked about having, we needed to relate to it with our patients. But I didn't really understand it at this level and in this depth, because when we talk about our need to self-regulate, get in touch with ourselves, because if you walk up to a horse and you are angry and agitated, that horse will sense what's going on with you and walk away. Or if you're just passive, that horse will just stand there. And if you say walk, the horse won't even move. You have to be connected. And it's the same way we do with people. I mean, if we aren't connected, it doesn't go well. So we need to help people understand how to get in touch with themselves, self-regulate, and then you have quite an impact on the person you're caring for or with. It makes a great difference. It's called co-regulation, and it's a soft skill, and it's a skill that is so necessary. I uh, talked with a friend whose mother, this is an anecdote, whose mother is not the easiest person to deal with, hasn't been her entire life. And now she's older and has dementia. And my friend said, I have been through so many agencies that come out and take care of her. And I finally found an agency that seems to have people who understand how to manage my mother's agitation and anxiety. And she said it's hard to find people that know that. Now, some people just kind of intuitively get it, but others, we just need to slow down. And it is so important to help people learn how to self-regulate and co-regulate. And it will make everything so much more efficient in what we're doing. Now, you'll still have bad days with some folks. That just happens. But we really do need to think about how we approach people and how we teach about this care relationship. If it's a care partnership, it is a care partnership, and it's the dyad that we need to focus on. And I think we've talked around it, but I haven't seen the science that explains it this way.
Mm-hmm. Yes. So the soft skills, if I understand correctly, of being able to understand my own emotions, regulate my emotions, that as a care partner will help me do a better job to co-regulate the person that is in my care.
Right.
And I believe in talking with a lot of people that have worked for many years in this industry, that this is not an aspect of caregiving that is often taught to people as they enter the field. They're taught the instrumental part of their work, how to chart, how to bathe and dress and turn and feed and do all of those physical kinds of things. But understanding how their well-being affects the well-being of the person in their care. In other words, as we've called it, the soft skills, it does impact the quality of care that's provided to older adults. So would you go as far as to say that training our next workforce, that it's essential that they learn how to self-regulate, and based on the evidence, that doing so will help to contribute to a more sustainable workforce? I think we all understand the challenges that we've faced with turnover, people coming in and leaving after 6 months, and some of the reasons behind that. So do you believe that teaching these soft skills will ultimately help with creating a more sustainable workforce that will be better prepared to provide quality of life?
I think it starts with when you say hello to the people when they come to interview for a position. It's in the culture of the organization that we take time and value our relationships, and the approach of how to, I think of, there's many techniques that are taught. This is a slow it down. It's a very soft skill, but it is essential. If
Mm.
we do not connect with the people we're caring for, it just doesn't work. My husband's been having some health problems and going for evaluations. And if a physician only looks at the computer screen and the time and is in and out almost in the middle of a sentence, you don't feel a connection. The trust isn't there. You've missed a lot of things and you walk out frustrated.
Mm-hmm.
And so that relationship, it's the dyad that's really, we've been focusing on getting tasks done, and we focused not to try to not just do that, but we get task oriented. And
Mm-hmm.
we need to look at that dyad. Are we connecting? If we aren't connecting, we're not going to be efficient, or we're not going to accomplish what we went in to do.
And if we aren't connecting, do you think it's fair to say that that is when the care partner is going to experience what often is referred to as a behavior, but what we like to change the terminology to a stress reaction? So if somebody with dementia is not feeling safe, they're not feeling connected, they are, in a negative state, that's when some of those stress reactions are going to make themselves known. So would you talk about one of the tactics that a caregiver can use? And this glimmers versus triggers was very interesting to me. Could you talk about how care partners who use this type, or I should say, are trained to use this type of an approach, how it can help to reduce and respond to some of those triggers?
Well, I think a number of us have learned about triggers. What gets us upset? What do we really do that, what's around us that just seem to just get us very anxious. But in studying polyvagal theory, I also came across glimmers. Well, that was new for me. What in the world is a glimmer? Well, we all know that there are some things when we think about them and focus on them, we feel more relaxed. Now, that's very individual, what that is. It can be music, some piece of music. It can be a scene. It can be looking at a lake, or it could be thinking about a relationship that's real positive for you. Just something, it doesn't take long, and it all of a sudden it brings you back to that state of feeling connected. Your autonomic nervous system actually goes into that state of, Oh, that's wonderful. I
Mhm.
was talking with one man and he said, "Oh, when I take a shower, I just love that water coming down on me." And I said, "I wonder if you were like that as a baby, if your mother gave you a bath when you to calm you down sometimes." He laughed. I don't know what it is with us. It's very individual, but it
Mm,
just can be a moment to think about something and it just brings you down. I used
mhm,
to do that with my students during final exams. I'd have them do some guided imagery. My goodness, some of them would go to sleep. You could hardly get them back awake again. They'd relax. So I think as we train our staff to go in, part of self-regulation is just to take a breath before you go in, especially if you have a lot to do. Just think of something that is pleasant and relaxes you. It might take a minute or 2 to get yourself in a better place. Then you can go in and begin to work with someone, especially if it's someone who's challenging to work with.
mhm.
And then, as you kinda learn that person a little better, that person has some glimmers too, and we do that often through some distraction when you distract someone who is having some cognitive difficulty and is anxious. Sometimes you can talk about something pleasurable that they remember from the past, and they'll calm down. That's a glimmer for that person.
Mhm.
So I think it's just a handy little tool to have that kind of helps with this self-regulation and emotional regulation with others that can
Uh,
be in our toolbox that's kinda handy to have.
Can I ask Laura Ellen to launch our next poll to all of you because we want to know if current training that you've employed includes anything like this, includes the soft skills training. Um, because Dr. Burke has made a case as to why it is really important to prepare workers for this. So I'm very curious to see how
Yeah,
many of you believe that this is already existing in your training curriculum.
yeah. And while folks are completing the poll, I'll just share, this has been great information and we've gotten a couple of chats just to the host and panelists, that they're enjoying and find this, fantastic to hear this information. So that's, the science behind the need, right, for these soft skills. And then I'll also share that AGE-u-cate has been partnering with Dementia Action Alliance, which is a fantastic organization that advocates for people living with dementia by people living with dementia. And we had a really, ironically, fantastic conversation with 4 people living with dementia yesterday, actually. And everything that we're talking about on this webinar, in their own way, they were echoing and supporting exactly what we're talking about. So we're working with them to really revise and dig deep in a educational tool that we provide our program partners around stress reactions, preventing them and responding to them. And these soft skills that we're talking about were the skills that they shared that are needed for themselves from their perspective for other people living with dementia. So it always gives me chill bumps, right? When the science and the research bumps up to the lived experience, right? Like all signs are pointing to this is so important. So I'll end the poll and so we know it's important. So let's see where people are in terms of whether you've been able to include that in your training. So I think these results, track with what we would
Yeah.
expect. I don't know if Shannon and or Dr. Burke, if you have reactions if you can see these results, but we've got about 53% say to a small extent, soft skills are added into training. The next is people feel maybe more moderate, right, extent. I do think this is, we're talking about this a lot more. So that's kudos for you, right, that are able to click the box of it's included at a moderate extent. That means, you're keeping connected and you're working with your organization to evolve and change your training. And then of course we have folks that say, not at all, and a handful that are a great extent. So that's a nice overview there.
Mhm. And what we are talking about here is sustainability. We need a sustainable workforce. And this could be the missing link to helping people be better equipped to step into this work and see it as a career choice and see it as their life's work. And so we are talking about needing to pivot and think differently about this next generation of workers. So I think, like Laura Ellen said, this is a really good indication of the need for us to be embedding these kinds of soft skill trainings to prepare workers effectively to stay and work in this industry. So I want to move now to, thank you for that poll, Laura Ellen. I want to move now back to Shannon, because we're talking about change. And what do you consider to be the most critical public policy initiatives that will support a sustainable aging workforce? And do you see that this topic of soft skills training is becoming a part of the dialogue and the conversation as you talk with your colleagues?
Thank you. So I think that what Dr. Burke has outlined is really important aspects on a micro level. And what I would like to share today is focused on the macro level. So I think that we really complement each other in the information that we're sharing today. So if we're applying like the soft skill concept on a micro level, the individual level, I think what I'm going to share with you is like the soft skill aspect on a macro level, which is this valuing culture of aging. So as you can tell by my answer to the previous question, I understand the system that we operate is in a very interconnected way. So I've listed several policies on this slide that I think are very important, and each one of them is very important in their own way. But what really makes the largest impact together is them as an interconnected whole. And that's not to say that items aren't missing from this list or that we're perhaps not addressing certain things. And I'll talk about that in a minute, but first I'll briefly review these policies just in case you're not familiar with them. So starting on the federal level, HHS has a national plan to address Alzheimer's disease. This has been around for over 10 years. It's accessible online and you can check that out. And that was really the catalyst to states starting to adopt their own dementia state, or as in Indiana, we call it our dementia strategic plan. So it means the same things. I've listed here the different thematic areas that our plan in Indiana focuses on. These are also very similar to what's focused on the national level in the national plan. So public awareness, meaning that people have a baseline understanding of dementia and they understand what it is, and that providers are also educated in the disease. Home and community-based services access. Do we have enough of these services? Where are they located? And how do we look forward to expanding that system? Because we know that that is going to be necessary to meet the demand. Quality of care. So we don't really have a lot of common standards of assessing dementia care when it comes to quality. So how do we know, like once we get these services, we have enough of them, how do we know that they're doing a good job and they're really meeting the person where they're at? Research. So in our state, a priority is documenting all of the research focused on Alzheimer's and dementia, and then also looking forward to how do we take all this amazing research Indiana, if it is not the premier, it is one of the premier states of conducting the most innovative research on dementia, but a lot of that isn't translating into practice in our state. So how do we make that bridge so that translation occurs? And then finally, addressing health disparities. We know that certain populations experience the effects of dementia in their community at a much higher rate. So that's our plan in Indiana. And then it also, I guess, conveniently left off workforce development. So we have a huge arm focused on workforce development. One, increasing the amount of folks that want to go into geriatric professions. Secondly, making sure that the workforce has dementia training that they can access easily. And then thirdly, addressing our adult protective service workers and first responders, making sure that they certainly understand dementia well. The next on here is CMS's guiding an improved dementia experience, the guide model. And it is one of the first time that Medicare is reimbursing for support of the care partner, of support of the caregiver. And so we've been around only for about 9 months. It's a demonstration project. And that is really exciting because we know that if we can support family and friend caregivers, that helps the whole field as a whole, and especially the person living with dementia, keeping them out of the hospital and living at home for as long as possible. HRSA's Geriatric Workforce Enhancement Program, the GWET program, you may know it as that. If states are lucky enough to have this provides a lot of resources to really enhance people choosing geriatrics as a profession in the medical field, social work, nursing, across the board, which we know that we need a lot more people choosing those career paths. States can also adopt specific policy initiatives to address the challenge we have around direct service workers. Indiana has gone down this path. We have a strategic plan that targets specifically direct service workers. That outlines things like they need a pay increase. They need to have more support. It has a lot of different aspects outlined in it. I would add that one of the most important things to do in developing any policy is to make sure that the voice of whoever this policy represents is incorporated into it. So, for example, with direct service workers, Indiana convened focus groups with direct service workers who served on a board. This was very innovative, and they contributed directly to the plan. Funding and resources. So it is one thing to have a policy, and we know that many policies that are perhaps very great and very robust and could have a really positive impact don't necessarily have funding associated with them. And that decreases the likelihood that they're going to have an impact. So we need to prioritize which policies we're going to be funding to make that impact. And the list goes on. I mean, there are many other policies on here that we could go over that are affecting the workforce. But next slide. Excuse me. So even though all of those policies were very important, I would argue that the most important policy a state can institute is a multi-sector plan for aging. So you may hear me for the rest of the duration of this webinar say MPA. So why is this the most important? Because it addresses the center of the wagon wheel. So kind of going back to the metaphor I started the webinar off with, it addresses the value that we place on older adults and aging. So what is an MPA? It is a roadmap that states can use to transform the full landscape of aging in your particular state. In Indiana, our MPA is called Age Forward Together, a united vision of aging for all of Indiana. So some key elements to point out in this title are words like together, vision, united. And we focused on 4 main goals that have a lot of bullets underneath them, but those 4 are age-friendly communities, reducing barriers, having each person's journey supported, and reframing aging. In all 4 of those areas, workforce is connected. And I think you can all clearly see that. So an age-friendly community, we need to have a workforce that can support that. Having each person's journey supported, we need to have an adequate workforce for that. And then reframing aging is also back to that very clearly, that center of the wagon wheel of reframing the value that we place on serving this population. An MPA, though, is a lot more than just its goals. So if done well, it's a very deliberate process that is inclusive, it's comprehensive, and it's community-centered. So I want to stop there, and I think those words really illuminate to me like the soft skills that Dr. Burke was talking about on the micro level. Those are like the soft skills on the macro level: inclusion, comprehension, community-centered. Public work groups are they define the content, they contribute to it, and they contribute to the vision of the MPA in the state. It can take months to a year to finalize, to work through, develop, and then finalize. And currently, at least 20 states have MPAs right now. But what I would say is that this is still very new. So this is still very innovative. It is still very new. Some states are doing this incredibly well, who have MPAs, and some states are still kind of struggling to figure out how do we implement this. So I love the quote on the slide from Kim, who formerly used to work in the California governor's office. And what she says about an MPA is that it's not another policy document that's going to just sit on a shelf. It builds a movement to improve communities and care for all of us as we age. So you may be asking yourself, well, what does a MPA have to do with supporting a sustainable workforce? And I would say that it says a lot. The process of developing an MPA brings the state together in a unified way to increase the value the state places on older aging. Thus, if we can increase the value, the center of the wagon, we will increase the spokes of the wheel tied to a sustainable workforce, such as increasing salaries, including more robust educational and training components focused on aging across professions: medical, social work, nursing, pharmacy, physical therapy. It will create work environments that will focus on positive reinforcement and not punitive aspects. And overall, it should increase the desire of folks in that state to go into fields focused on aging, because they're going into a field that they know their state cares about and actively supports. So that's the bottom line, right? Is how can we move our society to valuing aging? And I think that we can get there. And I think the MPA is a great concrete step that a state can take to move us in that direction. And if you're interested in learning more about an MPA in your state, the Center for Healthcare Strategies supports states in implementing MPAs, and that is the infographic that's there. It really outlines 9 different aspects of an MPA.
Great.
Can we have a poll up for you guys to answer, does your state have an MPA? And it's totally fine if you answer you're not sure. So, that at least you now know that this is something that I think, Shannon, you said 20 states have, and hopefully you can join to advocate for your state of creating one. Shannon, you might have said this and I spaced out. Is there a requirement for states to have a multi-sector plan for aging? Is there a deadline for them to get their act together to do it, or?
No, there is not. So there's no federal requirement to do an MPA, which in some ways makes it extra cool, right? Because again, it's the state saying we prioritize this willingly. Nobody is requiring us to do it. And It is for all people living in the state, but typically the Division of Aging or the State Unit on Aging is the one who leads the process, but it is, as the name says, multi-sector. So it's across state government and across other public and private sectors of the state.
Mhm.
Oh, fantastic.
Yeah. Did you share the poll yet, or still coming in?
Oh, I did. I don't know. Let me
Okay.
share again.
Okay. So I would encourage those on this webinar today, whether you are involved in a state plan or you don't know, wherever you are, if you advocate within your state for robust workforce training that elevates the next level of caregivers, that has to be and should be a component of any multi-sector plan for aging, is recognizing that those that are on the ground doing the work need to be and should be effectively prepared to encounter what they're going to encounter. And that is the best way that we can collectively work towards a more sustainable workforce for caring for our aging population. That's really the ribbon that we wanted to tie all of this up together, is to create an awareness that we just can't keep doing the same things over and over and expect a different outcome. And as we just talked at the beginning, this is maybe laying the groundwork for new opportunities for our states as more of them onboard these MPAs. And perhaps you all will be motivated to get involved if your states are in the middle of this. So,
Yeah. And
yeah.
Julie, if you
Mhm.
can stop sharing the
Yeah.
screen,
Mhm.
I'd just like to see everybody.
Of course.
Um,
Yep.
So yeah, and I'll add to all of this, I put in the chat some different ways that you can explore soft skills training if you're looking for something. I also encourage anybody to put in the chat if you are using a resource that is helping you integrate soft skills training into your organization. Please put it in the chat. We'll be sure to send all of this information to you as a follow-up, along with the recording and the slides. And I did wanted to share. I had a conversation this week with a representative from Beata. I think I'm saying that right. And they are working to host a roundtable with Congress workers, legislation in Maryland, to bring them together to have a conversation on dementia education. And they reached out to us to incorporate Dementia Live as a dementia simulation component to really bring the conversation to life. So whether it's Dementia Live or it's something else that you might have in your back pocket or a connection, I really encourage, the biggest way to make change is to let someone feel what other people are feeling. And then that really tends to ignite the conversation and get people who are the change makers, who can influence from the top, going and ignite with them. We hear that over and over with our program partners who are able to leverage experiential training in ways, not only from direct care givers and healthcare professionals, but up the ladder, if you will, to big decision makers. It's so effective across the board. So don't forget about the power of what you already have in your back pocket. And I'll say also the power of people living with dementia sharing their voices. So look inside your organizations. Who are you caring for? Who are you care partnering with? And find ways to elevate their voice, to bring their voice out. How powerful to get in front of decision makers with not you leading the conversation, but the person that they're making policy changes for leading the conversation, just like Shannon said, of putting those focus groups together, involving the people that these policies are going to change, or involving the people of the training program you're advocating for to find dollars for. So there's a lot of great innovative strategies, right, to begin to reframe. As Shannon started the conversation with the wagon wheel, how do we reshape our wagon wheel so the ride doesn't become so bumpy and we can smooth it out a little bit. And that definitely starts with, people in the center. And as people, we need people skills to care for people. And people skills are soft skills, right? They're not clinical. They're not ones that may be natural. It may be for you, but it may not. Yeah. Any other final words, Dr. Burke or Shannon? We're again at the top of the hour.
Well, just thank you so much. Thank you for all the work each of you do.
You too. Yes.
Well,
Well,
and-
there.
And thank you again, everyone. I had an idea that we still had some work to do with the soft skills. Some of you are doing it, some of you are in process, and I will be very happy. I would like to hear how this goes. So I think people will appreciate kind of seeing the science behind all of this. Thank you for the opportunity to share today.
Thank you. Thank you, everybody.
Yep. We'll see you next time. Bye-bye.